Let us have a detailed look as to how to present a tonsil case. Patient complains of recurrent sore throat, especially while consuming cold drinks. Cold is a viral activator and activates harbored viruses to proliferate and become virulent. In the oral cavity, the lips, angle of mouth, buccal mucosa, vestibule, gingivo-buccal sulcus, gingiva, teeth, dorsal ventral surface of the tongue, lateral borders of the tongue, floor of mouth, and hard palate are examined. In the oropharynx, the anterior pillars, soft palate, uvula, tonsils, posterior pillar, posterior pharyngeal wall, and the base of tongue are examined. In an acute tonsillar infection, the anterior pillars will be congested and the tonsils may be granular, hyperemic, and may contain pockets of pus if it is a case of follicular tonsillitis. When the tonsils are enlarged, we infer that by protrusion of the tonsils beyond the limit of the posterior pillar. After examining the oropharynx, a postnasal examination is conducted to assess adenoid hypertrophy, and the inspection is completed by finally performing the indirect laryngoscopic examination. The neck is then examined for the jugulodigastric node, which lies about a centimeter below and behind the angle of the mandible. This is also called the Wood's node, and often it is enlarged and tender if there is an infection. When there is no infection and in a case of recurrent tonsillitis, the enlarged node is often palpable. This is part of the examination of the neck, wherein the outer Walde's ring is examined for the submental, submandibular, jugulodigastric, preauricular, retroauricular, suboccipital group of lymph nodes, a group of lymph nodes that encircle the neck and constitute the outer Walde's ring. Investigations done in a tonsil case includes hemoglobin, because surgery should not be done when the hemoglobin is less than 10 grams %. Bleeding and clotting time to rule out bleeding tendencies, ESR to rule out infections, a total and a differential count to know the pattern of infections, and urine, especially urine sugar, to rule out diabetes. What constitutes the tonsillar bed? These include the superior pharyngeal constrictor, the pterygomandibular raphe, the middle pharyngeal constrictor, the tonsillar branch of facial artery, the glossopharyngeal nerve, stylohyoid ligament, again part of the middle constrictor muscle, and lastly the buccinator. The pterygomandibular raphe serves as an insertion point for two muscles, namely the superior constrictor and the buccinator muscle. We have what is called the Brodsky grading system to describe tonsillar size. Grade 0 is when it is within the tonsillar fossa. Grade 1 when it is just outside the tonsillar fossa, which is equal to or less than 25% of the oropharyngeal width. Grade 2 is when the tonsils occlude 26 to 50% of the oropharyngeal width. Grade 3 is between 51 to 75%, and grade 4 is when the tonsils occlude greater than 75% of the oropharyngeal width. What do you mean by the Walde's ring? The Walde's lymphatic ring is a collection of lymph tissue present in the neck. We have the inner ring and the outer ring. This plays an important role in protection against pathogens, and it is named after the 19th century German anatomist Heinrich Wilhelm Gottfried von Waldeyer Hartz. The inner ring is located in the nasopharynx and oropharynx, and its components are the adenoids, tubal tonsil, palatine tonsil, lingual tonsils. This helps protect the body against ingested and inhaled pathogens. The outer ring is comprised of various lymph nodes in the neck. Mostly they are cervical lymph nodes, and the components are the preauricular, the postauricular, the parotid, the facial, the submandibular, submental, superficial cervical, anterior cervical, and the suboccipital group of lymph nodes.